Well, President Obama starting a new PR offensive, trying again to sell you on the benefits of the new health care law. Part one of the new campaign tomorrow in Maryland. The president is doing a teletown hall where seniors across the country are invited to call in questions by phone. Well, not everyone thinks Americans are getting a good deal. Joins live is Republican Senator John Barrasso. He is also an orthopedic surgeon. Nice to see you, sir.
Great to be with you. Thanks, Greta.
Before I get to the question of whether or not the president is confusing or tricking people, which I think is a word that we say that you used, tell me, why is he selling this now? Maybe I should be asking him, but he won't come here. Why, I mean, I thought we had this health care bill. I thought it was a done deal.
Well, he knows it's a loser. He knows that 60% of the American people want it repealed and replaced, that things that are something that is patient-centered, that will actually get down the cost of care. Americans understand that this bill is going to raise the cost of their care and decrease their quality.
So why does he care, though? If, I mean, it's done. It's passed. I mean, like, even let's say 100% of the people didn't like it. It's still, you know, we have it, and it's going to go into effect unless it's declared unconstitutional in the state attorney general suit. It's there. So why?
Because they know they're going to lose a lot of races come November, because the American people are disgusted with the government takeovers and the spending and the debt and the fact that we're not focusing on the economy. But health care is just one proxy of the whole issue of what role government should play in any of our lives.
So it's a political pawn then, right at this point, selling it in terms of in anticipation of the November races.
Well, they're going to put up $25 million. The Democrats are. The story in the New York Times today, specifically working on a propaganda campaign. They've hired hotshot PR people who know a lot about PR, but they don't know anything, Greta, about health care. And this bill is bad for patients. It's bad for payers, the American taxpayers, and it's bad for providers, the doctors and the nurses that take care of the patients.
All right, I might add, I read the same New York Times article. Anita Dunn, who used to be the president's communications director, is also the one who is somewhat involved in this. I don't know how deeply involved she is in running this and what she gets out of it, but there is a lot of sort of rotating out of they're at least rotating out of the White House and still spearheading this particular issue. She obviously believes in it. All right, you say tomorrow that the president is trying to trick people. Well,
I think that folks who are paying attention to this ought to look at what's not being said. The president has pushed a bill, signed a bill into law that's going to cut $550 billion from our seniors on Medicare. It involves doctors, hospitals, nursing homes, home health, which is a lifeblood for people who are at home. The huge things, just cut. Medicare Advantage, that's all cut. You're not going to hear about that tomorrow. You're not going to hear about his new director of Medicare, who is someone who absolutely loves the British healthcare system and is in favor of rationing care. And then, you know, they did this mailer the other day, the Medicare and the new health care law, very misleading, propaganda all the way, and the American people paid $18 million to send this out to over 40 million Americans who are on Medicare.
So the American people paid for this flyer, you say, is misleading?
Well, it's very misleading because it says that they're protecting and saving Medicare, and they're not. Even the president's own actuary says it's going to drive up the cost of care, the quality and availability is going to go down. The president's actuary says that 1 out of 6 hospitals, Greta, will be in the red if this goes through over the next 10 years.
All right, explain to me what this costs. Let's say that I'm a 75-year-old woman and I fall and break my hip. How's it going to be different now for me than it was a year ago?
Well, you're going to end up going to the hospital. The hip will be fixed. It may impact, though, on if you need to go to a nursing home afterwards. It's going to impact whether you can get home health, whether the physical therapists are going to be able to take care of you through the entire recovery, because you don't get to decide how much therapy you get. The government will decide how much money.
Was I ever able to decide that? I mean, how much physical therapy? I mean, it's always my insurance company would say, okay, you get 3 weeks or 4 weeks or whatever it is.
Yeah. It kind of depends on how you read the law, because the regulations on a lot of these things, now, Greta, haven't been written yet. The White House has failed and fallen behind issue after issue after issue. All the deadlines that have been out there according to the law, they've missed them so far. I forgot.
Once the law is passed, it then goes out to the agencies to rewrite the rules and how we're going to implement this. So we're behind on that?
Behind, and in the bill that is now the law, over 1,600 times it says the Secretary of Health and Human Services will write the rules and regulations, and we don't know how those are going to be written.
They're not done.
Oh no, they haven't hardly started. That's why I'm going to the Senate floor every week, giving my second opinion, about a doctor's second opinion about the health care bill, because, Greta, every week there is some new unintended consequence of this health care law that the American people are finding out. You know, Nancy Pelosi said, you got to pass the bill before you get to know what's in it. The American people are finding out what's in it, and they don't like it.
Senator, thank you.
Thank you, Greta.